NYC at a crossroads, the problems we face and the path to a better future. I am Dr. Bibhuti. I will bring you today to your city, NYC. Stay with me, New York City, the city of ambition, resilience, and infinite dreams. But right now, our city is hurting. Behind the skyline and the bright lights, real problems are piling up, and they're hitting everyday New Yorkers the hardest. The real state of NYC. We're facing a critical moment in NYC's history. The pandemic may be over, but its effects still linger. Homelessness is rising. The subways feel less safe. Housing is unaffordable. Mental health issues are at crisis levels. Our immigrant communities feel unheard, and public trust in leadership is fading. This isn't just a list of complaints, it's a reality check. And today I want to talk about it. Not just what's broken, but how we fix it. As someone who's worked in healthcare, lived as an immigrant, and walked the same streets as you, I believe in real solutions. Bold ones. Community-driven, data-backed, human-first. Homelessness and mental health crisis. On any given night, nearly 90,000 New Yorkers are without a permanent home. Many of them are living with untreated mental illnesses. Our shelters are over capacity, underfunded, and often unsafe. This isn't just a housing problem, it's a public health emergency. Build community-based supportive housing, not just shelters. Every borough needs permanent solutions, not band-aids. Integrate mobile mental health clinics into underserved communities and subways. Fund city-based corresponder teams, mental health professionals, plus trained officers, instead of relying solely on NYPD. Mandate interagency collaboration between health plus housing plus public safety departments. We need a humane, coordinated approach, not criminalization. Skyrocketing rent and housing crisis. The average rent in Manhattan is now over $5,000 a month. In Brooklyn, even studio apartments are out of reach for working families. Gentrification has displaced long-time residents, and the public housing system, NYCHA, is falling apart. Solutions: reform zoning laws to allow more affordable housing developments in all boroughs, not just the outer ones. Convert vacant office buildings into low-income and middle-class housing post-pandemic. Audit NHA management and direct funds to urgent repairs via public-private accountability boards. Pass tenant protection laws that cap annual rent, increases citywide, and simplify eviction prevention services. Housing is a right. In NYC, it's time we treat it that way. Subway safety and MTA dysfunction. Our subways used to be the veins of this city. Today, they're unreliable and sometimes dangerous. Delays, assaults, fare hikes, and a lack of visible police presence have driven riders away. MTA debt is spiraling. Trust is plummeting. Solutions: install platform screen doors in high-traffic and high-risk stations to prevent accidents and crime. Create a transit mental health team to respond to crises underground. Invest in clean energy trains and tech-based upgrades using federal infrastructure grants. Decentralize MTA oversight, giving borough reps more control and budget transparency. Let's bring back a subway system that works for safety, for dignity, and for the environment. Mental health in schools and communities. As a physician who worked in psychiatry, I've seen how early intervention can change lives. But right now, mental health support in NYC schools and neighborhoods is a patchwork, if it exists at all. Solutions: place licensed social workers in every NYC public school, funded by reallocating underused DOE administrative budgets. Launch a citywide youth mental health initiative, especially targeting children in NYCHA and shelters. Partner with universities to create internship pipelines for therapists and community mental health workers. Create a centralized, multilingual, 24/7 city mental health hotline integrated with telemedicine and emergency services. Healthy minds build strong communities, and that starts with access. Immigrant disempowerment and services gap. New York is a city of immigrants. But many of our newest New Yorkers struggle with language barriers, job security, legal status, and cultural alienation. Too many face discrimination, poor healthcare, and no real support. Solutions: fully fund and expand city-based immigrant resource centers in all 5 boroughs. Provide legal assistance for immigration and labor rights, especially for undocumented workers and asylum seekers. Support multilingual mental health and parenting programs to reduce isolation and cultural trauma. Train and hire immigrants into city jobs, including transit, schools, and emergency response. When we empower immigrants, we strengthen the whole city. Bureaucracy, corruption, and accountability crisis. A big part of why nothing gets fixed in NYC: bureaucracy, corruption, inefficiency. From NYCHA to the Department of Buildings to the MTA and even City Hall, there's too much red tape, not enough action, and zero transparency. Solutions: launch a city transparency portal showing real-time budgets, delays, and performance ratings for every agency. Empower an independent NYC Citizens Watchdog Board with subpoena power to investigate fraud and waste. Use blockchain or AI to modernize permits, inspections, and licensing. Publicly disclose campaign donations and lobbying efforts in an easy-to-read online format. New Yorkers deserve a city government that works for them, not against them. Public health, climate and food deserts. Environmental injustice is real. From the Bronx asthma crisis to Brooklyn's food deserts to Staten Island's climate flooding, New Yorkers are dying younger because of their zip code. Solutions: plant 1 million new trees in underserved neighborhoods and fund rooftop gardens in public housing. Replace every diesel city vehicle with electric by 2030. Subsidize grocery stores, mobile farmers markets, and urban agriculture in food deserts. Create a climate resilience map to identify and invest in at-risk neighborhoods. Climate action is health action. Let's build a greener, longer living NYC. Unemployment and AI-driven job displacement. Many jobs lost during COVID-19 haven't come back. Now automation and AI are replacing cashiers, drivers, even creatives. New Yorkers are ready to work, but we must adapt. Solutions: create a public tech corps that trains New Yorkers, especially youth, immigrants, and former inmates, for jobs in AI, coding, green energy, and healthcare. Offer city-sponsored upskilling scholarships tied to in-demand industries. Incentivize businesses to hire locally by tying tax breaks to community hiring metrics. Let's not fear the future, let's train for it. Call to action: New York isn't broken, it's bruised, and bruises heal with care, vision, and action. We don't need more slogans, we need more listening, more doing, more humanity in policy, more accountability in leadership. I'm not here to make promises I can't keep. I'm here to listen, to learn, and to lead with you. Together, we can fix the things that matter most: homes, schools, subways, jobs, and justice. If you believe in a city where every voice matters, join me. Share this message, volunteer, talk to your neighbors. Let's build a safer, smarter, fairer New York City for all of us. Dr. Bibhuti